Hello, my name is Ashley Hubler, and this is my discussion on impairment and elective disability. First of all, I apologize for the weird glare. It's the time of day. The sunlight kind of slants directly into my bedroom window, so what can you do? But yeah, this is a very interesting topic. It concerns body integrity identity disorder, or BIID. It most commonly is associated with lower limbs, legs. So patients who suffer from BIID, they commonly state that they feel overcomplete, so as if they are born with one too many limbs. And some of these patients, they elect for amputation to remove the offending limb. So this is a very controversial topic in the medical field. I myself have taken the Hippocratic Oath as my time as a corpsman in the Navy. And the very first thing we pledge to is to do no harm. So this seemingly is in conflict with elective amputation if it's not medically necessitated. So it is a very major surgery that is life-changing, life-altering, and the potential complications that can arise from the surgery, such as infection and other complications, at first glance, I mean, the complications using cost-benefit analysis, the potential complications outweigh the benefits, right? But in the case of someone with BIID, that might not be the case. In fact, because these people feel so at odds with their own bodies, electing for this amputation could actually result in a better sense of self and consequently a better standard of life. So, referring back to the cost-benefit analysis, the potential benefits could actually outweigh the potential risks. And this also ties in with patient autonomy. I know there is a greater shift towards giving patients greater autonomy over their own care, which is something that I agree with. But something like BIID, it's something that I'm still struggling to understand. I will admit, when faced with something like this, with a patient who suffers from BIID, my first instinct would be to label this decision as being irrational or delusional. I personally cannot understand how someone could possibly want to have one of their limbs amputated if it's not necessary. But if the end result, if the end result is a patient achieving a better standard of living, which is, of course, the whole point of patient care, is to assist patients with achieving a greater sense of self, less suffering, and ultimately a better standard of living, then who am I to try to talk them out of it, right? And Gibson, he also goes into the differentiation between what constitutes impairment and disability. So he mentions that disability is a social construct. So someone who is impaired, it doesn't necessarily mean that they're disabled. So someone who is disabled is incapable of achieving anything they want in society. So someone, for example, someone who works in a factory who's missing one of their hands, if they're physically incapable of performing their job, then that would constitute them being disabled because they're physically incapable of achieving what they're trying to achieve. And someone with BIID is someone who wants to have one of their limbs removed. They wouldn't feel as if that would be a disability. If it doesn't impact their quality of life whatsoever, then they wouldn't be disabled. Gibson, he states that impairment is more of a biological term. So someone who is missing a limb is impaired, but if it doesn't impact their quality of life, then that wouldn't mean that they're disabled. I feel like that is an important distinction, especially in regards to BIID. So a medical provider who denies someone elective surgery for amputation, arguing that it would render the patient disabled, that would be an inaccurate assessment. So yeah, that's just kind of my 2 cents. I do agree with Gibson to an extent. I do agree with the differentiation between impairment and disability. I think that is an important differentiation to make. Admittedly, I still struggle with the idea of elective amputation if it's not medically necessary. It goes against all of my preconceived notions as a healthcare provider. It's not something I have ever considered before. I've never been faced with a situation like this before. So I'm still trying to wrap my brain around it, but it is a very interesting topic, especially when it comes to patient autonomy. So questions arise like, how far does patient autonomy extend, and how far ought to patient autonomy extend to where patients, they can elect to have these major transformative surgeries at complete will. And then medical providers are faced with the dilemma of not committing harm, but at the same time, utilizing this cost benefit analysis to reach the end goal of greater standard of living. It's very complicated. I hope I never am faced with a situation like that. It's very tricky. But yeah, that's just kind of my view on the topic. I hope this made sense. But yeah, thank you very much for listening.